Okay, today we will discuss the clavicle and the scapula. To begin, this is the clavicle, also known as your collarbone. The sternal end is the circular, more bulky region, and this is what articulates with your sternum, specifically at the manubrium. As for the other end, it's called the acromial end, and this is the more flattened end. Acromial end will articulate with the acromion on the scapula, forming the acromioclavicular joint. To determine whether this clavicle is left or right, the smooth end or smooth side of the acromion or acromial end points superiorly, and then the rough side points inferiorly. The sternal end always points medially, and then the clavicle has to curve outwards and then inwards. So this would be a right clavicle. Moving on to the scapula. The scapula has a very prominent spine, which always points posteriorly, so towards the back. The glenoid cavity is where the humerus articulates, so this always points laterally. So this being lateral and the spine pointing posterior, you can tell if this is a left or right, and this scapula here is a right scapula. A few other structures on here. We have the acromion process, so the acromion, and this is what articulates with the acromial end of the clavicle. The coracoid process, which is a muscle attachment. We already mentioned the glenoid cavity as well as the spine. We also have a notch right here called the suprascapular notch, which acts as a passage for nerves. And then we have the superior border with the superior angle, medial border with the inferior angle, and the lateral border